Hello, my name is Jocelyn. This video is about my septoplasty and turbinate reduction journey. The surgery is in a week and a half, and I had my pre-op appointment today with the surgeon, the ENT, and I asked a lot of questions, and I'll put these questions in the description because they may be questions you have too, or even things you didn't think about. I've had allergies my entire life, and for the most part, I can't really resonate in my nose very well. It's always just a little bit plugged like it is now. And I've just lived with it. I took a lot of medicine when I was younger, and then I got sick of taking medicine, and I just sort of have lived with it probably for the last 15 years. The reason I'm having this surgery now is one, I got sick of dealing with always being plugged up, always just having tissue, like just it's not fun. Having allergies and being plugged up is not fun. So I got a little bit sick of it. The other thing is that I've been singing my whole life, and there was part of me that was afraid that my voice was going to change if I had anything done to my face or my nose. And I've been singing long enough and have enough recordings of me from this point in my life before that the off chance it changes my tone slightly, I'm fine with. I probably wasn't fine with that 10 years ago. I was a bit more precious about my voice. And then the third reason is as I'm getting older, the amount of healing time it takes from a surgery just gets longer. And I wanted to do this surgery when I'm healthy, when I am quicker to heal, and where if there are any complications and I have to get another surgery, or if for some reason this surgery doesn't do enough, I still have time to get another surgery or get things repaired. So for me, it was really important that the surgery isn't too aggressive. So I just want to be able to sing and resonate in the mask of my face, which I haven't been able to do well for a while. I wanted to have a really quick healing time, or as quick as possible. So I didn't want an aggressive surgery. So these are the questions that I asked today. I asked what kind of reduction it was going to be. Was it going to be a radio frequency? Was it going to be a microdebrider? Was it going to be a cautery? And she said it was going to be a microdebrider and cautery. I asked about turbinate mucosa, which is like the outside. She wasn't going to touch the turbinate mucosa. That is what moistens the air and what filters the air, and that I didn't want touched. And I asked if the turbinates were going to be repositioned at all, or moved, or if they just were going to be reduced, definitely not taken out. And she said for the most part, they're just going to be reduced. There's one bone that she was going to bend and inside the lower turbinate and not take out, but basically fracture and bend. She said that's really common, mostly just to get it out of the way. And I asked how much tissue was going to be taken out. Most doctors, I guess, decide that the day of, once they see it. I asked in general, are you more aggressive with your reduction of the turbinate or conservative? And she said conservative, and I said great. Another thing I asked about, which I'm sure you'll find lots of videos on, is empty nose syndrome. She said it was very rare, and when I looked online, there were mixed reviews. Some said it was very, very rare, and others said it's more like 20%. So I specifically asked her, how many cases have you had from your surgeries that had empty nose syndrome? She said 0, and then she said, because I take care of my patients, which to me meant that she at least feels she's a considerate, thoughtful doctor that doesn't she's not overly aggressive with her reduction. Because I'm a singer, I asked specifically, when can I get back to singing? When can I start taking work again? And my surgery is on a Thursday. That night I usually sing, that Sunday, and the next Thursday I usually sing. And because she puts in tubes inside the nose, it's challenging to sing with the tubes in the nose. So she said those stay in a week. I would not sing really for a week. After that, there's no real danger in singing. It just might be uncomfortable, and you might not sound like yourself. And I said, well, I might have an audition in 2 weeks. And she said, 2 weeks, you should be fine to sing. It still might feel a little bit awkward and tender, but it's not going to hurt you to sing. So that was really important for me to hear. The only thing she did say when it comes to singing is She did say the swelling might change my voice temporarily because of the swelling. One suggestion I got from YouTube was that you stop doing any kinds of nasal spray so that when you go into surgery, it's just very like, this is what it would be with nothing. So I've stopped doing any Flonase or nasal spray for the surgery, which is in a week and a half. Because my voice is my instrument, I asked about intubation. So this surgery, you go under and they put a tube down your throat for breathing. There have been a few people I've known in the past because of intubation, their vocal cords were damaged after the surgery. And she was surprised to hear that, but she said, your surgery isn't very long and we can ask to have the smallest tube put in your throat that is available to you. So I said, that'd be great. She also suggested the day of surgery, when I'm having my discussions with the doctor and the anesthesiologist, that I reiterate that I'm a singer. Please be very, very careful when you're putting a tube down my throat. I need to be back up and singing as quickly as possible. She did say that regardless of how big the tube was, that I was going to be scratchy for a few days. Just like when you have a sore throat or when you've been singing a lot, vocal rest is always the key. So after the surgery, I probably won't sing, or I definitely won't sing, but I won't talk much, and I'll probably be very, very gentle with my throat. My plan for the next week and a half, because there'll be probably a week and a half after that I can't sing very much. And if you've been singing for a long time, you know that when you stop singing, your voice can get a little bit rusty. So what I have to do in the week and a half leading up to the surgery is I have to sing a lot. And I do that because I'm not going to be singing for a chunk of time. The before really matters when it comes to how in shape my voice is afterwards. So normally I sing anywhere from 30 minutes to 2 hours a day, depending on the day. And for the next week and a half before the surgery, I need to probably sing an hour and a half to 2.5 hours a day. It's kind of what I would do leading up to like a big set of gigs, is to like work my voice so that I'm in really good shape, or at least my voice is used to singing a lot by the time I get to the gig. But instead of a gig, it's surgery, because after that time, I'm going to experience a temporary sort of lax in my voice, and it's going to get weaker. So I really need to build up my voice before, so that once I start singing again, it won't feel like it's been that long. The other thing I'm going to do body-wise is just prepare my body for healing. So I take vitamin C every day, but instead of once a day, I'm going to start taking it 2 times a day. Some other things I'm sort of doubling up, so that by the time I get to the surgery, my body is going to be in good shape. The goal is that after the surgery, it's going to be traumatic. My body will experience trauma, that I have built up some reserves, both vocally and body-wise, that I'll heal pretty fast. And then we'll see how that helps my healing. So if you're in a similar position, I hope this is helpful, and I hope that you are able to make a good decision for yourself.